Good morning, everyone. Bonjour. I was going to say I hope everybody had a nice summer, but it wasn't probably nice for everyone because there are so many different effects of COVID that we're all dealing with right now. So, but I know there was some nice weather, and I hope that people did take advantage of the nice weather and a beautiful place to spend it here in New Brunswick. Cela fait maintenant plus de 6 mois que la pandémie de COVID-19 est commencée. En tant que province, nous avons relevé le défi. Nous avons réussi à limiter l'introduction de cette maladie et à ralentir sa propagation. And I am very proud of all New Brunswickers who have done their part and helped us stay in the yellow phase that we are in right now. Alors que les cas de COVID se multiplient dans les États et les provinces au sud et à l'ouest, nous pouvons être fiers des résultats que nous avons obtenus jusqu'à présent. Mais ce n'est pas le moment d'être complaisant. We have had 200 confirmed cases to date and 2 deaths. We have had 1 significant regional outbreak which involved a hospital, a daycare, 2 daycares actually, and an adult residential facility. This was brought under control thanks to the diligence of the people in the Hamilton-Restigouche region and all of the partners working very, very hard to successfully control the outbreak, including our public health teams. We have avoided the silent spread of this virus through our communities, so we don't have community transmission here. And to date, 94% of the COVID-19 cases reported in New Brunswick have been directly or indirectly linked to travel outside the province. And over the course of the summer, we saw that repeatedly. So people who were coming in from internationally, so international students and temporary foreign workers, they all self-isolated properly. They were tested on day 10 of their self-isolation, and any of the positive cases that turned up could not infect any others, and therefore there was no transmission. Dans la grande majorité des cas, nos protocoles d'auto-isolation ont permis de restreindre le virus à ses voyageurs. Durant la phase jaune, les Néo-Brunswickois ont pu se rassembler et la santé publique a offert des conseils sur la façon de le faire en toute sécurité. Nous n'avons pas interdit les rassemblements comme l'ont fait d'autres provinces ou territoires. COVID-19 has not beaten us, but we have not beaten it either. COVID-19 is still out there and we must remain vigilant. Our risks are changing. So what we're seeing outside of our province, just across the border in Quebec, what we're seeing in Ontario and other provinces in the country, what we're seeing in the United States, Maine, our border right next door, our border state next door to us, there are significant risks. And so as we want to keep the risks as low as possible, as we go about our lives, we have to continue to adjust to the new normal and continue to adjust to the new risks. The sudden rise in new cases in Maine, Quebec, Ontario, and elsewhere in the past month shows how quickly the virus can spread. It's urgent that we continue to take precautions to prevent this from happening here. All of New Brunswick is in the yellow level of recovery, and if we continue to work together, we can keep it there. So just remember to keep calm and stay yellow. It is so very, very important that we don't let our guard down now. Even though we've achieved this great amount of success, our schools are back up and running, people are working, people are able to interact within the Atlantic bubble very successfully and safely. The only way to keep that level of success that we have achieved is to continue to work extremely hard together. Il est urgent de continuer à prendre des précautions afin d'éviter que cela ne se produise ici. Tout le Nouveau-Brunswick est dans la phase jaune du rétablissement et si nous continuons à travailler ensemble, nous pouvons la maintenir. Your dedication and discipline have kept us at this level over the summer and enabled the reopening of schools last month. We all want to maintain our enviable record in this pandemic. No one wants to return to more restrictive measures, and I have to say that achieving success takes a certain amount of energy and action. Maintaining that success will equally take a lot of input and energy and action. This can be done if we continue to follow the guidelines of being aware of your surroundings. Large gatherings carry a greater risk for spreading COVID-19, so avoid large crowds where physical distancing cannot be maintained. When you are out, remember to maintain 2 meters between yourself and others, a barrier the virus cannot cross. Ayez toujours un masque avec vous et utilisez-le lorsque vous ne pouvez pas garder cette distance physique de 2 mètres par rapport aux autres. N'oubliez pas de vous laver fréquemment les mains avec du savon et de l'eau chaude ou d'utiliser un désinfectant à base d'alcool à 60%. C'est vraiment important qu'on travaille ensemble maintenant. C'est vraiment très important d'identifier les risques nouveaux. Alors, on connaît que les gens continuent à voyager et travailler hors de la province et rentrent la province aussi. Ça, c'est le risque qu'on veut éviter d'avoir des problèmes avec. Alors, si vous-même, vous travaillez hors de la province et vous tournez, ou si vous avez rentré la province et vous avez des exemptions, même que vous avez des exceptions, il faut vraiment prendre du temps d'être sûr que vous n'avez pas mis les autres en risque. So people who travel from outside the province, outside the bubble, and who have exemptions for self-isolation, I think at this time, based on the increasing risks, we need to be way, way, way more vigilant around our surroundings and who we're interacting with to make sure that we don't have any cases and outbreaks. And I think that we really, really want people to make sure that they keep their number of close contacts low, because that helps with the contact tracing process. We carry around organ cards, say that we're an organ donor. When you go to the hospital, you have your next of kin and emergency contact information. It probably would not be a bad idea to keep that list of people that you have close contact with in the event that you were diagnosed with COVID-19, and you can give that information to public health immediately. The sooner that we can trace contacts and the sooner that they can be isolated, the fewer people are at risk of being infected and the fewer people that we would see involved in an outbreak. We all want to be able to gather, and no one wants to see restrictions, but we can't have gatherings if they aren't done safely. Large gatherings mean more contacts, more risk of spread, and more complications. This is a disease, this is a virus that spreads exponentially, and those numbers can go up very quickly, again, as we've seen in our other neighboring provinces and states. If we see an increase in outbreaks, we risk falling back into the orange level or even the red level of recovery, and nobody wants that. Avoiding this requires commitment and collaboration from all of New Brunswickers. I continue to strongly urge New Brunswickers to wear a face mask or covering in indoor public spaces. Je continue d'encourager vivement les Néo-Brunswickers à porter un masque ou un couvre-visage dans les espaces publics à l'intérieur. C'est vraiment important aussi de diminuer le nombre de contacts étroits. Et comme vous allez à l'hôpital et vous avez un contact d'urgence ou vous avez une carte qui dit que vous voulez donner je ne sais pas comment dire organ donor en français, les donneurs des organes, c'est vraiment important peut-être à ce moment-ci de garder une petite liste de contacts étroits. Puis si vous êtes contacté parce que vous avez diagnostiqué avec le COVID-19, vous pouvez donner cette information à le staff, aux santé publique pour aider dans la recherche des contacts étroits pour que ça puisse se faire très, très vite. C'est un signe de respect quand vous portez des masques. Le fait de porter un masque ou de se couvrir le visage vous empêche de propager la COVID-19 à votre insu et empêche les gens autour de vous la transmettre. J'avais eu une réunion cette fin de semaine avec un organisme et il y avait quelqu'un qui avait dit que 6 ans passés, sa fille a déménagé au Japon. Et quand il a été là pour le visiter, il a dit qu'il avait aperçu, ça c'est bien longtemps passé avant la pandémie, que plusieurs personnes portaient des masques. Alors, il a demandé à sa fille pourquoi que les gens portent des masques. Il dit, c'est un signe de respect. Quand il ne sent pas bien, il porte un masque pour qu'il n'infecte pas des autres. Alors ça, c'est quelque chose culturel qui était déjà en place dans d'autres pays du monde avant la pandémie. Alors que nous êtes dans une pandémie, ça serait une bonne idée qu'on adopte cette approche de protéger les autres. It's a sign of respect, and wearing a mask or face covering keeps you from unknowingly spreading COVID-19 and keeps the people around you from spreading it to you. More New Brunswickers are getting into the habit of wearing a mask, and that's encouraging. But to protect our most vulnerable, we need to stay well ahead of the course of this pandemic. We will be monitoring mask use across the province, and I will not hesitate to recommend a mandatory order if this becomes necessary. But at this point in time, again, we've seen many, many encouraging signs that people are respecting the public health directives. We cannot wait till a crisis overwhelms us. It's really important to stay ahead of this pandemic. We have to stay a few steps ahead because it's easier to stay ahead than it is to catch up after we've fallen behind. It is vital that we continue to be mindful of these actions that we can take to slow the spread of infection in advance of the second wave. We must incorporate these public health measures into our daily routines so that we can live with COVID-19. Life doesn't have to be put on hold. As long as we approach our activities with awareness, vigilance, and kindness. Public health has always given guidance around not what you cannot do, but what you can do to make your activities safer, the safest possible, to reduce the risk to being as low as possible. The risk will never be zero, but we want it to be as low as possible. Thanksgiving is approaching, and many of you are wondering how to celebrate this occasion. Everyone wants to be gathered with their families and friends for food and fun. It can happen, and it can be done safely if everyone follows the guidelines I've set out today. And my advice would be to keep your gatherings very small this year. Some places, some jurisdictions are having virtual celebrations. They're not actually able to gather in person. So keep yours as low as possible so we can keep having gatherings. And if the weather permits, have your Thanksgiving outdoors if you can. Being out in the fresh air, we know, reduces those risks. Keep hand sanitizer handy and make sure everyone washes their hands before eating or preparing food. And really and truly, you know, we've been talking about wearing masks in public places, but if you are attending a Thanksgiving dinner and you are feeling well, I would prefer that everybody who's not feeling well stay at home. If you were supposed to host a Thanksgiving dinner and you start not feeling well, you have to have a backup plan for canceling or rescheduling. If you have people, family and friends who you can deliver a meal to, then that would be better than hosting people, etc. Tenez compte des personnes qui peuvent présenter des symptômes de la COVID-19 ou qui seraient tout particulièrement à risque si elles contractaient le virus. Vous pouvez préparer un repas à l'avance pour le livrer le moment venu ou utiliser la technologie pour rendre votre rassemblement virtuel. Et si vous êtes quelqu'un qui peut être à risque parce que vous avez sorti hors de la province et retourné, ou si vous êtes ici avec des exceptions, ça se peut que la meilleure action que vous pouvez faire, c'est de vraiment limiter les contacts étroits et peut-être éviter d'avoir des rassemblements, d'attendre des rassemblements. Please ask, if you are sick, don't attend a Thanksgiving dinner. If you have people that you're inviting, please tell them to stay home if they're not feeling well. And again, it's just not worth the risk. This will be a different Thanksgiving, but with some thought and planning, it can still be special. The same goes for Halloween. If guidelines are followed, everyone should be able to have a Halloween that is both safe and fun. If you are giving out treats, keep cleanliness in mind. Sanitize your hands in between visitors and keep high-touch areas such as door handles and railings clean. And consider offering non-food treats like stickers or colored pencils. Trick-or-treaters should wash their hands before heading out and upon returning home. You can organize costume parades for the trick-or-treaters so that the kids can show off their costumes while maintaining physical distance. Les personnes déguisées pour l'Halloween qui iront sonner aux portes doivent se laver les mains avant de partir à leur retour. Vous pouvez organiser des défilés de costumes d'Halloween pour les enfants afin qu'ils puissent montrer leurs costumes tout en gardant une distance physique. And if you have someone in your home who is at particular risk for COVID-19, consider putting a sign on your door, have a happy and safe Halloween. No visitors, please. And I've seen that in other jurisdictions' websites, that you can print out a sign and put it up on your door, and you can feel comfortable and safe that people are going to respect your wishes, and you're not going to be putting yourself at risk or others at risk, again, if you are at risk of giving COVID to somebody else. And more information and helpful hints on this are available on GNB's coronavirus website page. So this year will be different, but we can adjust. The return to school has brought anxiety for many families, especially around testing. And this is front and center of our discussions right now. So we're examining the data and watching the progress of the virus in other jurisdictions to help us determine the best approach for testing of school-aged children. And if your child does have to be tested for COVID-19, please assure them that this test is painless and nothing to be frightened of. As a parent, I know how difficult it is not to transfer our anxieties to our children, but we have to do our best in their best interest. We have faced this and so many other challenges in the last 6 months, and we have overcome them together. COVID-19 is knocking on our door, and You can infect others even if you look well and even if you feel well. At the beginning of the pandemic, I did encourage everybody to behave as if they had COVID already and act accordingly. And again, especially if you know people who have traveled outside the bubble, or if you yourself have traveled outside the bubble, it's really more important that you really be careful with your interactions. We have achieved so much success, and we have so much to lose if we don't continue down the path that we have gone down so far with respect to following all of the public health measures and direction and guidance. Nous pouvons poursuivre sur la lancée de succès que nous avons connue jusqu'à présent. La suite des choses, encore une fois, est entre nos mains. Merci beaucoup. Thank you very much.
Good morning. Bonjour. So far, New Brunswick and the entire Atlantic bubble have been able to effectively manage the COVID-19 pandemic. Our number of cases have remained low, with most of those cases connected to travel, not community transmission, making our fight against the virus much, much easier. That's because of the concerted effort that has been made by all New Brunswickers to heed the warnings from public health and follow the measures to reduce the health risks to all of us. Nous avons été en mesure de procéder à la réouverture des entreprises et de nos écoles de manière efficace. The threat, however, is once again literally at our doorstep. Our neighbors in Quebec and Maine are tackling outbreaks and seeing increases of the virus, while other areas in North America are struggling to flatten the curve. Just over a month ago, Quebec was making good progress. But 2 days ago, that province had 933 new cases in a single day. And as of September 30th, there had been more than 75,000 cases in total in Quebec. 12 deaths occurred in Quebec just between September 24th and September 29th. They've lost nearly 6,000 people since this pandemic began. Des mesures de confinement ont dû être imposées de nouveau aux villes de Montréal et de Québec. Cela signifie que les entreprises doivent encore fermer et que les résidents doivent rester à la maison une fois de plus. This shows how difficult large outbreaks can be to manage, especially in large cities and highly populated areas. In Maine, we've seen what can happen even in a small gathering. A wedding in August, attended by 62 people, most of whom did not wear masks, led to more than 100 COVID-19 infections and has been connected to at least 8 deaths. In recent days, 7 mill workers at Woodland Pulp in Baileyville, Maine, just across the St. Stephen border, have tested positive for COVID-19. All the workers at the mill, including a small number of New Brunswickers who work there, are now being tested for the virus. These situations drive home how close the virus still is and how quickly things can change. Notre message est demeuré le même depuis plusieurs mois. Lavez vos mains fréquemment, demeurez à 2 mètres des autres personnes, et quand vous ne pourrez pas maintenir cette distance, portez un masque. Those simple steps are what helped us get to where we are today. Yet I know some have become complacent. For many months, there has been a line in the emergency order that states, if you are not with your family or friends and in a public area where you cannot maintain physical distancing of 2 meters, you must remove yourself from that area or wear a face mask. The use of face masks has certainly increased greatly since the pandemic began, but there are still those who are not using them. Certaines personnes peuvent être exemptées de porter un masque pour des raisons médicales. Et je comprends cela, mais cela concerne uniquement un petit nombre de personnes. Je sais que certaines personnes ont l'impression qu'elles peuvent aller dans un espace public sans porter de masque, parce qu'elles pensent pouvoir respecter la distance physique. Cependant, tout le monde sait que même avec la meilleure intention, il est difficile de maintenir cette distance. Although I prefer not to make mask use mandatory in public spaces, I know that it may be soon necessary, even as early as October 8th. When you go into a public setting where physical distancing may be a challenge, have a mask with you, and please put it on. If we all do that, we are protecting each other, and we can reduce the rate of transmission of the virus. We are working closely with public health and are continually monitoring this situation. Staying in the yellow phase of recovery is essential to maintaining health, keeping our economy open, and keeping our schools open. We have seen continuous success within the Atlantic bubble. While border measures will remain in place for travelers from outside Atlantic provinces, we are planning to suspend the screening of travelers entering New Brunswick from Prince Edward Island or Nova Scotia by land. This change will be in effect as of Thursday, October 8th. I have been in discussions with these changes with my colleagues in Nova Scotia, Prince Edward Island, and Newfoundland, and we will continue to have these discussions in the coming days. This will allow peace officers to focus on other efforts to prevent the spread of COVID-19, such as ensuring compliance with guidelines like 14-day self-isolation, gatherings, and business operations. It is important that our diligence continues. It is important that we look after each other, and we cannot lose sight of just how close the virus is to an outbreak at any point in time. Depuis le début de la pandémie, j'ai souvent dit que tous les gens de Nouveau-Brunswick ont un rôle à jouer pour protéger les gens autour d'eux. C'est toujours le cas aujourd'hui. I understand that it is easy to become complacent when the risk appears low, but we must remain vigilant so we can continue to enjoy the freedoms we've had here and to access all of Atlantic Canada as we did all summer long. I am pleased to see the guidelines public health have provided for Thanksgiving and Halloween. I'm asking all of you to follow these guidelines closely so we can enjoy these activities without putting each of us or any of us at unnecessary risk. It is because of our diligence that we've shown over the last many months that's allowing our province to open up more quickly. It's allowing our province to enjoy life with COVID, only enjoy it as we once did with just a few different rules. I've seen the comments from some people asking, why do we have to do these things when we have so few cases? We need to do these things so we can continue to have few cases and to ensure the virus is manageable. Together, we can keep New Brunswick in the yellow level of recovery. And together, we can continue to enjoy our entire province in many of the functions that we always have, only in a new and different way because of COVID. Thank you. Merci.
Merci, Monsieur le Premier Ministre et Dr. Russell. Thank you, Dr. Russell and Premier Higgs. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Premier Higgs or Dr. Russell. Are the 7 New Brunswick residents who work at Woodland Pulp still awaiting their COVID-19 test results? And are they at home isolating at this time, or do they continue to go to work? How have they been instructed to proceed?
Hi, Vicki. So great question, and obviously front and center of people's minds when you hear about an outbreak that is happening so close to our border. The way the information travels back and forth between the United States and Canada is between the CDC and PHAC, Public Health Agency of Canada, and then Public Health Agency of Canada then gives us the information. So as of right now, the information that we have is that they have done the contact tracing, they are testing people at the mill, and my understanding is that any any close contacts are self-isolating at the moment, and we should be getting the results back for any of the 400 people who have been tested in the next day or so. So when we have more information, we'll share that. But as of right now, my understanding is the public health folks in Maine are dealing with the situation in terms of the contact tracing and the self-isolation. And so as of this moment in time, again, what we know about the cases and the close contacts is going to be something that that we will share when we have more information. But in the meantime, continue to follow the public health measures and do all the same things that we've been doing all along in terms of hand washing, wearing your masks when you can't physically distance, staying 6 feet apart, et cetera. So that's the advice in the meantime while we wait for more information.
Thank you, Doctor. Vicki, do you have a quick follow-up?
I do. Thank you, Dr. Russell. My follow-up is for Premier Higgs. Premier Higgs, there's concern in southwest New Brunswick that New Brunswick residents who either work in the United States or dual citizens or are allowed to enter for essential goods are abusing these privileges and are staying in the U.S. to do non-essential activities. How can the general public be assured that this is being monitored beyond just the honor system? Are you working with CBSA to document when Canadians have left the country, or do we just record them when they return?
So there is a high degree of the honor system in this whole approach of managing and monitoring our borders. So there's no question about that. However, we are taking a renewed effort to analyze the thousands of people that do cross our borders for essential purposes and understand exactly the frequency, the timing, the location. That's why when we talked about changing our border rules between, let's say, PEI and Nova Scotia, it's putting our efforts into ensuring the rules and understanding more about people that are moving across those critical borders, and those would be into the U.S. or into Quebec. So that there is a renewed focus there to understand this movement, because there is a level of concern that there are activities could be happening that we just need to have closer scrutiny on.
Thank you, Premier. Thank you, Ms. Hogarth. Erica Butler, CHMA Sackville.
Hi, this is a question for the Premier or Dr. Russell. So we've heard from residents concerned about being able to get transportation to testing sites if they require a test. Are there plans to improve accessibility to testing sites, or even to add more places people can go to get a swab taken, like, for example, in rural hospitals?
Hi there. Thank you for the question. My understanding is that it is being looked at, and because we are aware of that situation. So the RHAs are helping us with that. So when we have more information, we'll be able to pass that along. But thank you very much for your question.
Ms. Butler, do you have a follow-up?
Yes. So we're hearing about long waits to process testing results, especially in other jurisdictions, and we've had long waits here in New Brunswick, especially during September. What is causing that delay? Is it the actual testing system that we're using in the labs, or is it the notification of patients that's the center of the delay?
So we did see some delays at the beginning of the school year when school was back in at the beginning of September. But that really had to do with a surge in students that were being tested, and we have addressed that by increasing capacity, increasing the hours, and we've really had a really great way of looking at the process to streamline it. We actually have an online way of getting referred instead of just using 811. So we did have a spike in those tests, and we did have additional resources that are to address it put in place, and so now there is no wait time. We are able to get the tests processed really quickly now, and in fact, my understanding is that we've had 10,000 hits online for those online assessments that didn't have to go through 811. So we're very pleased with our ability to meet the demand and address that surge, and we'll continue to monitor and continue to streamline as things evolve. But as of right now, the wait times are very short. We really wanted a turnaround time of between 24 to 48 hours, and I think we've achieved that.
Thank you, Doctor. Thank you, Ms. Butler. Pascal Rachnog, l'Acadie Nouvelle.
Oui, bonjour. Ma question est pour le Premier ministre. Monsieur Higgs, pouvez-vous nous expliquer qu'est-ce qui s'en vient exactement le 8 octobre? Le 8 octobre, parce que je suis un peu confus. Est-ce que vous allez adopter, imposer le masque obligatoire en public? Si oui, pourquoi? Qu'est-ce qui se passe exactement là?
So certainly, we are looking very seriously of having mandatory masks in public spaces. And as I mentioned this morning, we've had meetings with public health, and we met as a cabinet and COVID cabinet committee. What's behind it is what we're seeing around us with outbreaks, and how a simple process of wearing a mask could have prevented those outbreaks. So the other aspect of right now is in terms of timing is simply, we're allowing people to think more, more about when they're out in a public space, what they're wearing, and taking a mask with them and putting it on to avoid the chance that they could run into someone whether it be a grocery store, whether it be in any particular public place, and not be able to social distance. The need, I think, is self-evident with relation to what we're seeing around us. The timing is based on what we see for voluntary adherence. When we're changing the borders between our Atlantic bubble partners, it will allow us more scrutiny into what's actually happening in other parts of our province and how well the protocols are being followed. So that could play a little role in the timing, whether, and I mentioned as early as October 8th, but it could be pushed out a little bit. But I think we're seeing it across the country. There's various forms of wearing masks. We know that in Newfoundland they have adopted this policy. In Nova Scotia they've adopted this policy, and so certainly it's something that I would expect most people in the province are anticipating.
Thank you, Premier. Merci, Monsieur Rachnog. As-tu un suivi?
Yes, I'll ask this one in English because I'm still confused. So, will you impose mandatory mask restrictions in public October 8th? Is that your plan?
I didn't say that was the plan as being absolute. October 8th, what I said that there is a possibility we will implement this next week. It could be in a week or two out, but we're going to be in a position that we understand our adherence rules, and conditioning the public of the need to do this. That's why I talked about the different outbreaks we've had around us. So I guess the only clarity here I'll add, it could be as early as October 8th, or it could be delayed a few weeks, but I would suggest that mandatory masks are coming soon into our province.
Monsieur Rachnog, thank you, Premier. Dan Arsenault, allnovascotia.com.
Oh, I don't have a question.
Thank you, Dan. Mike Cameron, CTV News.
Thank you, Bruce. Premier Higgs, just on that point, you've expressed your reluctance to go ahead today with mandatory masks. I was wondering if you see us. I mean, a lot of the market is already doing that. A lot of big box stores are already doing it. A lot of institutions have already made masks mandatory. On this particular question, are we following the curve as opposed to getting out in front of this particular issue?
Well, I think if you, and it's a very valid point, because that's the reason that we're saying, do we jump out and make it mandatory, or are people already following that? Because it has been a suggestion from public health and ourselves now for months that when you're in a confined space, when you're going into a public space, we encourage people to wear a mask. Always have a mask with them when you leave home. So that's the idea, that the situation is, we think we're doing that. Many businesses are enforcing it, but some aren't. Some are saying it's optional. It's not. It's we're okay. So I think what we're saying here now is that we're seeing reports, the epidemiology reports, the data that we've seen from recommendations are that masks do save outbreaks. And what we want to determine is how well are we adhering? How many businesses are actually adhering to this? What kind of a step change is it? This is kind of a prelude to let people know that we're expecting mask adherence, we're expecting the public health rules to be followed, and we're encouraged by what we see, but we're also concerned about incidents that have been happening where the rules have not been followed. So I would say, you know, as I just finished, that it's likely something that we will implement. To this point, we've been successful without that mandatory requirement, but we don't want to take any chances. So it's just another added measure to insist upon it, as opposed to right now where we're recommending that it's being done. And we give businesses a chance, some of them that have said, well, this isn't really something we're doing, maybe to reconsider.
Thank you, Premier. Mr. Cameron, do you have a quick follow-up?
If you don't mind, to Dr. Russell, Bruce.
Sure.
Dr. Russell, with respect to those Canadian workers from the mill on the American side, are you able to order them, or have they been ordered to isolate in New Brunswick while they wait for test results? Or are you able to do that, order them to isolate in New Brunswick while they wait for test results, as opposed to going back and forth?
So whether they're a Canadian who works outside of the province or a New Brunswicker who works here, the public health process is the same. So the contact tracing would be done and close contacts would be identified, and those close contacts would be told to self-isolate. I don't have the exact information on who is a close contact and who's not a close contact with respect to the New Brunswickers at this time, but if they are close contacts, they are being told to self-isolate, and that's true of all cases who are positively diagnosed in their close contacts. So that's what I can tell you right now, and again, our public health folks are talking to the public health folks in Maine, as well as CDC and Public Health Agency of Canada. So as I told Vicki, when we have more information, we will provide that. But if they had gotten tested and they have test results and they are positive, then our public health people will do the contact tracing on this side, and whatever processes and actions that are going to be taken after that are going to be communicated with the public. But at this point in time, CBSA and Horizon and the town of St. Stephen are also working together to make sure that what needs to be done is being done.
Thank you, Doctor. Thank you, Mr. Cameron. Mia Urquhart, CBC.
Thank you. My first question is for Dr. Russell. There's still a lot of confusion about testing and school attendance. You've said that students can get tested with only one symptom, but is testing mandatory? Do they have to for one symptom?
So first of all, I am a parent, and the frustration of parents and teachers and staff right now, early days, I can completely relate to and understand. And so we have been working on trying to streamline things a little bit to clarify. But in the meantime, the public health advice right now is that if you have one symptom, you can get tested. If you have two, also you can get tested. But what we want to make sure is that we're trying to be cautious at this time, but we know that there is also the overlap with cold and flu symptoms at this time. So, and we know that other provinces have changed their list of symptoms and testing criteria. So right now, again, we understand the frustration and the confusion, and certainly if kids have fever, vomiting, diarrhea, pre-COVID, those children would have had to stay home. They would have been at home, regardless of the fact that we're in a pandemic and we have COVID. We know that runny nose is a symptom that is has been shown to be in cases in children who have COVID and have tested positive. So again, we are conducting our jurisdictional scan to make sure that we have all the information we need to make a new decision around moving forward. So in the meantime, the evidence, the guidance that we've provided so far is to, again, stay home when you're not well in terms of, fever, vomiting, diarrhea. And if you have one symptom, yes, you can get tested, and we want people to come to school when they're well again. But if you have two symptoms and you choose to get tested again, this is what parents have to choose to do. We can't make them, but if they have those symptoms and they get tested, they have to stay home for until they get their test results back.
Thank you, Doctor. Ms. Urquhart, do you have a quick follow-up?
I do. This one's for the Premier, please. Do you have any concerns about shifting staff away from the border with Nova Scotia, for instance, to Quebec and the main entry points? You once talked about concerns about the Halifax airport. Can you address those again, and do you feel any safer about that now?
And you are correct. I had those concerns about the airport, and those are being addressed as part of this change. We're able to work with the Nova Scotia government to improve the scrutiny at the airport of who's coming and going and where, because that was the stalling point, is not understanding well enough who was flying into an international airport. So that is the issue that is being resolved, and that will allow us to make the changes right at the land borders, and that was the only concern. So other than that, it allows freedom within our Atlantic bubble, and it's another step for us to, in Atlantic Canada, to be proud of what we've accomplished together, and to be able to, I guess, recognize that it brings a freedom during COVID that maybe is not enjoyed in other parts of the country, but we're opening up with COVID. That's our goal.
Thank you, Ms. Urquhart. Shelley Steeves, Global TV.
Yes, thank you. My question is for the Premier. Just pertaining to mandatory masks, I'm wondering why we're not moving forward with that now. We know that the number of cases in communities surrounding New Brunswick are already seeing that increase, and we know that Nova Scotia has had the policy in place for several weeks now. I'm wondering why there seems to be a reluctancy. Why are we delaying and saying, well, maybe only by October 8th or maybe even later? What is the hesitation there in not just going ahead and saying, you know what, masks are mandatory right now?
So we have had the same success in the province, I guess one might say, with the policy that's been put in place about recommending masks where it's used. So we've had good adherence to the program, and we feel obviously that's part of our success. And our record here in the province, and compared to any other province, would illustrate that. So when you add more restrictions to individual freedoms, it's part of saying, well, okay, are we doing it anyway voluntarily? Do we need to put in a measure unnecessarily, or are people working with us to follow the public health rules? So it's kind of a balancing where you want people to embrace the protocols that are keeping us safe and to be part of the solution willingly and openly, because that's what we need. We need the attitude to be, I can do my part. I can be a big help here in protecting my fellow citizens in our province. And then the balance between, okay, well, we don't see that happening, so we need to put a new rule in place. So I'm always cognizant of that, because I feel much better in working together as creating a solution as opposed to an arbitrary rule change. And that's the reason is as we roll this out, it's kind of like we got to make sure we continue to be coherent about using masks and protecting ourselves. And I believe that the balance of recognizing that people, to a large extent, have been doing that, but we've been seeing some pockets of, let's say, losing that focus.
Thank you, Premier. Ms. Steve, do you have a quick follow-up?
I do, actually, pertaining to that same topic. So then how are you planning to monitor this situation over, say, the next week or 2 weeks to ensure that more people are complying? That seems to be kind of the message you're trying to get out there, encouraging more people to wear the mask if they aren't doing so now, and businesses who may not be enforcing it. How do you plan on monitoring that over the next couple of weeks to see if you've hit that threshold where you're going to make the decision that masks are going to be mandatory?
Well, certainly the changes to the borders within Atlantic Canada would be a big part of freeing up people to be more accessible, to be in the community, to be looking at commercial operations, public operations, to see what the adherence levels are. So we can have more boots on the ground, let's say, roaming around our communities, as opposed to being on a border between Nova Scotia and New Brunswick. So that is part of this exercise, is giving more people the freedom to be in the communities and actually witnessing firsthand, in a greater volume, I should say, of what is actually happening.
So those officers will actually be monitoring for masks?
We're going to be out, and as we're monitored, WorkSafe, as we've done all along, we've been monitoring for mask usage, and we've been monitoring adherence to the compliance rules from public health. So that is not a new thing. That's been going on ever since the start. But resources are always placed where they're needed most. And so our focus is we need to have solid resources on our Quebec border and certainly with what's going on back and forth for the U.S. And we need to now look at adherence within our own population to ensure that, if people are coming back, let's use an example. People are coming back from working in other provinces and working in New Brunswick. Back several months ago, we said, well, okay, you're coming back to your family. No other province was self-isolating outside of our Atlantic bubble. We would allow them to come back and not self-isolate, but we expected them to wear the mask if they're out, to social distance if they're out, and be very cognizant that they are travelers. And so we will now be checking on them more closely. You know, are you indeed ensuring you're meeting the health guidelines while you're home? Because those are the things we just can't take for granted.
Thank you, Ms. Steves. Charles Cameron, TVA.
Oui, ma question s'adresse là à Dr. Russell ou à Premier ministre. En fait, concernant les frontières là, interprovinciales entre le Québec et le Nouveau-Brunswick, un peu plus tôt là, au mois dernier, là, vous avez fermé la bulle avec la MRC du Témiscouata au Québec et une partie avec la MRC d'Avignon. Est-ce que présentement vous avez regardé pour réouvrir ces bulles-là avec ces régions du Québec ou encore avec le reste du Canada? Est-ce que vous avez ciblé une date précise pour rouvrir ou il est encore beaucoup trop tôt avec le nombre de cas qu'il y a au Québec présentement?
There's certainly no date to reopen the border because of the situation. I mean, Quebec have gone into a lockdown essentially, and so the changes we made in the kind of the reduced bubble area and the Avignon Peninsula was basically as a result of what's going on in Quebec. And we're working with the Quebec authorities to ensure, and working with the First Nations community there to ensure that the travel in and out of that community is very much restricted and controlled, so we know who's moving in and out of that First Nations community, who subsequently then could be moving into our community on the New Brunswick side. So it's very much right now hold. We hope that we'll be able to keep open the portion that's still there, because we have school kids as well, over 100 that are coming to the New Brunswick side to every day. So we want to keep that activity. We certainly don't want to interrupt that, but in order to keep it safe, we have to be very sure that that area is indeed staying safe itself. So right now, status quo, while we can maintain the bubble within the community, the First Nations community on the Quebec side, but no plans for further opening in the rest of Quebec at this time.
Merci, M. le Premier ministre. M. Cameron, as-tu suivi?
Oui. Ma prochaine question est pour le Premier ministre. Là, vous voulez, entre autres, vous considérer en fait que la population doit porter le masque là, dans les endroits publics. Vous le recommandez fortement. Est-ce qu'au courant des prochains jours, prochaines semaines, vous allez demander aux autorités de la province, aux entreprises, aux magasins, de surveiller là, un peu plus là, si les gens portent le masque ou non au courant des prochains jours?
Yes, we will be doing that. We'll be working with the different businesses and communities leaders and to ensure that we are seeing greater adherence where we find that opportunity, that there needs to be an improvement. We will be working with those business leaders.
Merci, M. le Premier ministre. Monsieur Cameron. Bobby Jean McKinnon, CBC.
Yes, hello, sorry, I haven't been able to hear it off Philly, so I apologize if I'm covering ground that's already been repeated, but Premier Higgs, you said in an interview with CBC this morning that you're not going to make masks mandatory right away because you want the public eased into the requirements, but it was June 5th when the province first announced masks would be mandatory to enter public buildings and then reversed that decision. And, here we are, October 2nd, and you just mentioned a while ago that, you believe that people are anticipating this, especially since our counterparts in Nova Scotia and Newfoundland have already imposed this mandatory order. So why do you feel people need more time?
Well, I think if you look at our record in the province, we have 5 active cases today. The adherence, we believe that's a direct result of the adherence to the rules that public health have put in place over the last several months. So if we are meeting or exceeding the level of protection, then you don't need additional legislation or additional, factors imposed on citizens. So the point of this is basically saying, we have great results. And if that wasn't the case, there wouldn't be any debate here at all. We would just do it. But we've had great results without having it mandatory. Now, as we review and have more scrutiny around the businesses, we see what's going on in public spaces. And if there are a lot of infractions that show up as a result of this, of our increased scrutiny, then that's why I'm leaving this door open. That's why we're saying, it may be required. Because we're not going to take the risk. We're not going to go by chance. We haven't done that since we started, and we're not going to start now. We've been very cautious, but we're very respectful of how people are looking at New Brunswick and how people in the province are adhering to the rules. So it's a process. It's unfolding, and I think we're managing this at this point to the best of our ability. And I guess in our case, what we've seen is our biggest success has been related to border protection. And in our situation, 95% of all cases are related to travelers. And so the point is, that's where we're putting our efforts. And it's travelers coming outside of the Atlantic bubble.
Thank you, Premier. Ms. McKinnon, do you have a quick follow-up?
Yes, this one's for Dr. Russell. You mentioned about the 7 contractors at Woodland Pulp in Maine testing positive earlier this week, and now a mill worker tested positive yesterday. We know that 7 New Brunswickers work at that mill and travel back and forth. Why didn't we hear about this sooner, and what is public health doing to keep them and other New Brunswickers safe?
So Public Health has been working with our counterparts at Public Health Agency of Canada and CDC, and also the public health employees in Maine. And so basically, the way that public health works is, in terms of what we tell the public, is if there's a public risk that there's been exposures in the public, then we usually would announce that right away. But in terms of the risk assessment, at the point in time when we were aware of the situation, the risk assessment was being done by Public Health Maine in terms of tracing close contacts of those original 7 cases. And so if the New Brunswickers were identified as close contacts, they would have been contacted directly and told to self-isolate at that time. So in terms of mitigating the risk, that is the process that was being followed, and then the information was flowing again through CDC to Public Health Agency of Canada, and then down to our counterparts here in public health. And so the RHAs and the town of St. Stephen and public health in the South region, our team down there, have been in constant communication with the partners, and it is an evolving situation, but based on the risks that we were aware of at the beginning, there was no real need to communicate at that time, because our understanding was that the protocols and procedures that should be followed were being followed. So we are planning to provide more information as more information is available. 400 people were supposed to be tested, I think 200, and then another 200 workers in Maine, including the ones from New Brunswick. So whatever results happen at that time, and if there's any more need to do contact tracing and self-isolation for people that would be involved, that will take place.
Thank you, Ms. McKinnon. John Chilliback.
Yes, I'm not going to ask about rotten, contaminated onions, but this is almost as important. Walmart Canada recently has been advertising a coronavirus Halloween mask for kids to buy, and I just wanted to get Dr. Jennifer Russell and Premier Higgs' opinion about that. And I do have a follow-up question.
Hi, John. I think probably throughout the pandemic, there's probably been many items for sale in different contexts and in different stores, whether it was online or in Walmart, that people could access. I don't think I have a comment specifically around that particular item, but just to say that, again, I am aware that throughout the pandemic, there could be things that are more appropriate than others. And again, my concern in terms of public health is around the safety of Halloween in terms of how to do it safely, and how kids can have fun while we're in the yellow phase. And that's my message, really, is we can have Halloween, we can do it safely, and I encourage you to do so.
Mr. Chilliback, your follow-up, please.
Actually, I wanted Premier Higgs to weigh on that before the follow-up.
I don't know if the Premier has seen the photo of the mask. So can you please ask your follow-up?
It's pretty easy to imagine, so I'm just asking him what he thinks of that, like of kids potentially donning these from Walmart.
John, I really don't have anything to add to what Dr. Russell said. I think that we have to be cautious here. The coronavirus is no joke. It's a very serious pandemic, and it's a lot of people's lives have been lost because of it. So I would suggest that in any situation, due care and caution has to be always used, so children and adults alike recognize how serious this is, and that we ensure that information is shared appropriately about the risks.
John, the quickest follow-up, please.
Yes, a follow-up. Thank you very much. This is for Premier Higgs. A couple of years ago, the Patient Connect NB wait list had 27,500 people on it. And I know at the time you said the goal was for the government to get that to 0. The latest numbers I've seen say that there's 37,000 people on that list, which would mean more than a third more people on the list. So I wanted to know why the government's failed to reduce that list and what it plans to do to try and get it back down and eventually get it to 0.
Well, I guess I would need to understand if what is an accurate number right now, John, and I am asking for that because we have some big plans in place about wait lists and primary care. We learned during the pandemic about primary care could be accessed through virtually, and that now is up and running and accounting for a very high percentage of our total primary care access points. So I think that number is very different now, and so our goal is still to get it down. We're talking about wait lists for surgeries, elective surgeries. We're planning by March 31st to have that wait list cut in half for hip and knee replacement, and that is ramping up as we speak in the hospitals, particularly zeroing in on St. Joe's at this point. I will be following the stats very closely. As you know, we did have a pandemic in the midst of all this, which did slow down some of our earlier programs. I intended to maintain a balanced budget as well, and I kind of lost that ability. So a lot of things changed during the pandemic.
Thank you, Mr. Chilbeck. Andrew Waugh, Telegraph-Journal.
Yeah, my question's for the Premier. Premier, I have to admit to being quite confused about what's been said here today. On the one hand, you say we're doing really well with masks and the borders with Quebec and Maine are going to be really tight. On the other hand, you're saying you're seeing instances of people not wearing masks in businesses, which, to be fair, every New Brunswicker has seen since the day COVID arrived. So public health's consistent message has been, we will change the rules on masks when we have data and evidence that shows it is necessary. So can you specifically speak to the data and evidence that you are going to collect that will inform your decision?
So the additional data that we want to collect is what infractions do we have? What are we seeing for gatherings? And we've had different, let's say, complaints come in that are identifying gatherings that are exceeding any of the public health rules in terms of what would be considered safe practice. The idea of us moving is being generated too by what we're seeing around us. So we can have one traveler come through that could be an essential service traveler, but all of a sudden is in a situation where it infects many people. I used some examples today. And so the idea here is that, yes, we've been successful. Yes, we hope to continue that. And if we see such large outbreaks right against our border, which we are now seeing, what is the risk of the movement across the border that would enhance a change to what we're doing? Because the intensity is so close. So there are a number of things that are changed immediately around us right now, particularly with the Quebec border, even across the main borders. We talked about the incident with the Baileyville Mill. So those things are causing us to rethink, okay, do we need to tighten up further? Now, what adherence do we have? We're checking with our businesses and the communities. Are we consistent? Are some stores doing just the opposite of others, meaning some require masks, some don't? And why? What's the difference? We want consistency of adherence to the public rules. And so I guess this is an indication today that we're looking for that consistency. And if we do not find that consistency, then a policy around mandatory masks is forthcoming.
Thank you, Premier. Mr. Waugh, quick follow-up.
Halloween was mentioned very briefly. Can somebody walk me through what's been decided and specifically what the rules will be if they're any different than any other year, please?
Hi, Andrew. We have all that information on our website. I do have a couple of points I can make around some simple points. Basically, the information around Halloween was based on whatever phase we happen to be in. So if we're still in the yellow phase at Halloween, it'll be certain pieces of advice and direction. If we're in the orange phase, it'll be different ones, and obviously red would be very, very different. So that's the first thing I'll mention about Halloween. And again, it is on our website, so I can direct you there. And so what you'll see on the website is we have a kind of a one-pager that has all the information. Actually, I guess it's 2 pages, sorry. And basically, it's saying that in the yellow level, if that's where we are, then we're saying that informal indoor and outdoor celebrations are permitted with a maximum of 50 people if you're advised to keep a list of participants. Any businesses, organizations, or groups that plan events such as malls are required to have an operational plan for any Halloween activities, and they must keep a list of participants, and physical distancing must be ensured. Door-to-door trick-or-treating is permitted if public health advice is followed, and that's outlined. And if children in your household go door-to-door, they should avoid contact with anyone in your family and friend bubble who is at a higher risk for several days following Halloween. And as I mentioned earlier when I was speaking, if you are a person who is at risk and you really don't want to participate in Halloween and you really don't want anybody coming to your door, it is okay to put a sign up that says, Happy Halloween, not really offering the trick-or-treating tonight, but there are some signs you can put up as well to let people know that you're not participating in Halloween. And that's okay. You know, this is a pandemic, and so we don't have everything the same as business as usual. So anyway, and I do encourage you to look at the website for more details.
Thank you, Mr. Waugh. Thank you, everyone. Merci beaucoup, tout le monde. Voilà la fin de notre mise à jour. That concludes today's update. Thank you very much.